And my father died in 1949 when he was 49 years old. He had hypertensive heart disease and had a stroke. And he and my mother were divorced at that time, so that his entire estate was half in my name. So that in order to be the executor of his estate, I had to be a resident of Illinois, because there was some people who were unhappy and some people were trying to get some of his money. But anyway, so that I went back to Illinois, and I went to my chief at the University of Chicago and said, I have to be in the state. He said, sure, I've got a job for you. So that I worked in ambulatory pediatrics for another year. Then it was time for me to take the board in pediatrics. So that my husband was finishing his training at Meharry, and I went back down there intermittently with him. And I said to the chairman of the Department of Pediatrics, I am board eligible, I want to take my board. And he said, I don't think you're ready to take it. And I think it was because I was the first person that he had trained to be board eligible, and he was afraid that I would not do well. But I just had the mindset I was going to pass it. So then Amos Christie and Charles, let's see, I just have to look at my notes here a bit. Francis Howell Wright was chairman of the department, and those were the two persons that sponsored me for my board in pediatrics. I took the first part of the American Board of Pediatrics at Vanderbilt, and some of you in this room, I don't think anybody's old enough to remember the blue books. No, it wasn't objective, you wrote blue books. Yeah. But anyway, I took it at Vanderbilt, and then within 24 hours, Amos Christie called me and said, don't worry, you passed, you know, you're fine. So then we didn't have to wait a year or so. You could take the second part 6 weeks later. So I took the second part at the Cincinnati Children's Hospital. And that was quite an experience, because they had us come out and sit in a room afterwards. After you had finished your orals, you sat in a room, and then a staff person would come out and say, you may go or you have to stay. So we didn't know whether or not you may go meant that you had passed.
Right.
But anyway, we had finished all of our training, and we had decided, well, we went several places in the South trying to decide where we wanted to practice. We went to Atlanta, we went to cities in Florida, we went to cities in Texas. And I told my husband, take me north of the Mason-Dixon line. Now this is still, you know, not before the civil rights movement. So then we came back to Detroit, which was my husband's family was well established there. And, oh, I forgot to tell you, after I took my boards, I went to Toronto, where the American Academy was pediatrics. I finished the boards that spring, and that fall, I went to Toronto, and I was inducted into the American Academy of Pediatrics. And there was only about 500 membership at that time, and there was not another African-American female, with 3 or 4 men in it. But anyway, Bob Frazier was the executive secretary, and we had been residents together at the University of Chicago, so I always felt very comfortable with the AEP and was warmly welcome. Then we came back to Detroit. Now I had just been in academic medicine all my life. I never thought I would go into practice. I didn't want to go into practice. I didn't know anything about practicing pediatrics. So that when I came back, on the way back from Toronto, I went down to Children's Hospital, had an interview with the chairman of the department, and the chief resident took me around the hospital. But I did not know what the hospital was like. We were in the old building. This was before the Detroit Medical Center was built. I didn't realize the Children's Hospital had never trained a black resident. They didn't have a black pediatrician on the staff. There was just nobody. It was an old boys club. But anyway, they said, well, I had to go and move furniture from where we were living out of town. I had half a van from Chicago and half a van from where my husband was in order for us to live in Detroit. So that I had to go back there, and I wasn't permanently at Children's Hospital at that time. So then when I came back, I went to the hospital, And they had, you know, I had been interviewed and so forth and so on. So for about 2 weeks, I worked in the emergency room, I worked this place, I worked that. I said, you all have got to tell me something. You know, I have to know what I'm going to do. So the chairman of the department said, well, I don't control my budget. He said, you have to go down and talk to this elderly white woman who controls my budget. So I went down and I was sitting there like this, and she was going through my resume and all my recommendations. She said, oh, you're so well trained, and you have such wonderful recommendations. Then she looked at me and she says, but we have no money for you. So I said, I didn't cry then. I just got my things and left the hospital. And then I said, what am I going to do? You know, I don't know. I don't want to go into practice. What am I going to do? But anyway, I got on the phone, called my chief at the University of Chicago. He was at that time executive secretary of the American Board of Pediatrics too. So he called over to Children's Hospital in Wayne State University. And that Monday, they called me and said, well, we have a position for you in pathology and hematology. Now this, you know, yeah, but this was, Wolf Zaltzer was the big wheel then. And I said, well, for me to have an opportunity to get some additional training after Wolf and be in his department. So I said, I'll go in the back door and maybe I'll kick out the front. So that I did it, and I learned a great deal from him. And I had an opportunity to interact with other faculty members. So I didn't have a faculty appointment then, though. So then my husband came to Detroit. He was through with his training. And we decided that, well, we will go into private practice because there was no black pediatrician in Detroit. So and my husband's family was well established there. So we bought a building it was a transitional neighborhood, and we remodeled this building, and it had an apartment upstairs. It had 3 apartments and 3 commercial at the bottom. So we took 1 unit and just made it a beautiful office. We thought we were all set, except we were $75,000 in debt. But when we graduated from medical school and finished our training, we didn't have any debts. And then I had some money from my father, too, so this helped. So anyway, I guess this was 1953. Yeah, 1953. And about 2 o'clock in the morning, a telegram came. Captain Kane, you got your call to come to the United States Army Force. So that he had to go to the service for 2 years. When he left, April the 1st, 1954, I was 5 months pregnant with our first child, and I had this beautiful little Pomeranian puppy, and it was a snowfall. I never forget, April the 1st, we had a snowstorm when my husband left to go to the service, and I was there holding this dog, crying again. But, you know, the people in Detroit were so supportive of me. There was no other pediatrician. I could have stayed in my office until 10 o'clock at night. I had we brought a woman from Alabama as a nursing mama for our child who was going to be born. And then, so I gave her an apartment in our building, and I gave my office staff person an apartment. So they didn't even have to drive to work. So they just had to come downstairs to work. But I worked until the night before. I worked the night before until my child was born the next day. Then I came back to work 3 weeks later and worked all the time with no problem. And my husband was stationed at Fort Leonard Wood, Missouri. He asked for 5th Army area. He thought he was going to be in Michigan. And when he got to his installation, he was the only board-certified surgeon there. Unfortunately, he operated on the commanding officer's wife. He did a splenectomy on her, and he was declared for that installation. So we never got to go anyplace except Fort Leonard Wood, Missouri. But he had a wonderful time there, operating and so forth. So then he got out of the service. We had 1 child. And when he came home, my daughter says, "Daddy, I don't like this house. I want a house with grass. I want a backyard." So that we bought our first home, which we stayed in for 15 years. Now, at Children's Hospital, they did give me an attending appointment. So, and when I went there, the patients were still segregated. The black children were the clinic patients in one ward, and the white children were private patients there. So after I went into practice, the first time I admitted a patient, I said, this is a private patient, so that my patient was put there with the private patients. I didn't get my first faculty appointment until, what, 69? Yeah, 69. But by this time, and when I first went to Children's, they would take my records to see whether I'd made a mistake. See, I had my informants. So the underground, I knew what was going on. But I worked very hard, and we joined the Wayne County Medical Societies, we joined the Michigan State Medical Societies. I was very active on many of their committees. I went to every agency in the greater metropolitan Detroit area, like the Catholic agencies, the Lutheran adoptive agencies, and said, I am a board qualified pediatrician. I want you to know I'm in practice here. And I met with the heads, with the chairpersons of all these departments. Then,
the race riots in Detroit.
Oh, yes. Oh, but I wanted to talk about my faculty appointments. By this time I had carved a niche for myself at Children's Hospital. I spent so much time at Children's Hospital with the residents, they thought I was a full-time faculty person. So in '69, I was an instructor, and then I was an associate, no, what's the next one? Assistant professor, then an associate professor, and then I have been a full professor for about 20 years. But anyway, I love teaching, and I want to talk about the rioting. Yes, because we had moved out of the office that we started into a new building, which was on Woodward Avenue. And this must have been, what, the early 70s? Yeah, I guess so. But
67?
Well, the riots were in 67, but we had moved out of this building where we had remodeled it and so forth. But we didn't know we had a riot clause in that property. And so when the president declared this a national emergency, so we got double indemnity. We got all of this, double what the building was worth. So that was very good for us.